Hey, this is Dr. Clay Williams at the University of Texas Health East Texas Medical Center here in Tyler, Texas. I had a personal message on my webpage last week asking a very legitimate and good question. This gentleman wanted to talk about penile implants. He was thinking about having one, wanted to come see me, and his first question was, how many do you do per month? How many do you perform per year? Strangely enough, most patients don't ask that, and they should. So let me turn it around. If you or a loved one, your spouse, was contemplating having a rotator cuff surgery repaired, or a torn meniscus in your knee, or even a total knee or a total hip, would you really see an orthopedic surgeon who did 1, 2, or 3 per month, say 15 or 20 per year? No, you absolutely would not. So why would you trust a urologist to your most prized possession, your penis, where you're having erectile dysfunction, to do a surgical penile prosthetic implant and does a low volume? You wouldn't, but it happens all the time. In fact, 90 to 95% of all penile prosthetic implants nationwide are done by urologists who do less than 25 per year. In fact, it's actually closer to maybe 15 or 12, and it's terrible. So the question has been asked for quite some time of who should be doing penile implants. Finally, we may not have the exact answer, but we do have some interesting statistics that came out at the Sexual Medicine Society of North America annual meeting last fall in San Diego. So I'm going to glance down a couple times, make sure I don't miss this. But in 2017 to 2020, a study was done. Now, granted, it was retrospective. It wasn't randomized. It wasn't prospective. It was looking back at the data. But it was a large database of 12,350 patients who had a penile implant in. And they wanted to see, was there a cutoff in the volume that the surgeon did to determine the reoperation rate? Now, the reoperation was due to infection or malfunction, dissatisfaction. It was a number of things, but they wanted to see what the reoperation rate was at 90 days and at 1 year. And here's what it was. If a urologist did 25 or less penile prosthetic implants per year, the 90-day and 1 year reoperation rate was at 34% and 35% respectively, versus someone who did what they considered a high volume implanter, which is anything greater than 25 implants per year, which personally is still a very low volume implant. That should be 30, 40, probably even 50 or more. But nevertheless, the 90-day and 1 year reoperation rate, for whatever reason, was at 2% and 6%. So huge, statistically significant finding. So my point is, if you have erectile dysfunction, if you're contemplating having a surgical penile prosthetic implant, please, you have to ask how many, on average, per month, per year, implants does that urologist do? Because we clearly see it's 4 to 5% reoperation rate in the high volume implanters versus 34 to 35% reoperation rate in the low implanters. So do your due diligence, do your research, and pick wisely. If you have any questions, please do not hesitate to contact me at rclaywilliamsdo.com.